Hi, welcome to Thinking Green. I am Ronna, and we are continuing our series of pre-recorded Zoom interviews. Hopefully by summer, we'll be able to start doing a few in-person ones. But for now, I must say the virtual interviews have been great because people don't have to drive. And, today is Earth Day, and saving, the driving is a good thing. Yeah. So today's show is going to be on the topic of healthcare. It's been in the news for so many reasons over this past year. And my guests are Marilyn Vashey, Holly Hackett, and Dr. Justin Paglino. And I met all of them really through Medicare for All Connecticut events, but all of us are also affiliated with other groups that are advocating for better healthcare in the country and in the state of Connecticut. So welcome, Marilyn and Justin and Holly. And I guess I'll start, and you can go really in any order to introduce yourself and how this subject became a passion for you, and what your focus is. So.
Sure. Well, I'm Justin Paglino, and I went to medical school and I did training in clinical pathology or lab medicine, and then I did training in medical research and got a PhD in virology. And I've always kind of cared about justice issues and fairness, equality, economic and social and environmental and peace issues. I mean, they all kind of tie together for me as human rights issues. And medical insurance is something that we were exposed to, of course, in medical school. We got some overview of the health insurance system as it stands. And, I was left with the impression that it was not that impressively comprehensive. It was impressively complex, to be sure. But we know that it's underserving our population. There are so many people who can't afford the healthcare they need. So we're going to talk about why we support a single payer healthcare system today, and how that improves things. My activism these days is that I'm involved with Medicare for All Connecticut, which we'll hear more about, and Physicians for National Healthcare program. And also as a form of activism, I've joined the Green Party and ran for Congress last year, and I'll be running again in 2022 in the 3rd Congressional District, which is New Haven and surrounding towns, so that single payer healthcare, aka Medicare for All, can be on the ballot and people can vote for it, because there's a lot of support for it out there. And I think it's an issue that needs a candidate, so that people who want to have their support for it registered need a candidate on the ballot that they can vote for to show that support.
Well, I would really like to bounce off that, Justin. There is a statistic saying that more than 50% of Republicans support single-payer health care. So, yeah, we're part of a movement for sure. I'm Marilyn Vashey. I'm a psychiatrist, and I live in New London. I grew up in a union household, so phrases like, what's good for General Motors is good for the country. Topics like that would come up at the dinner table. So I grew up with that kind of sensitivity to economic and equity issues. As a physician, I've worked in the very, very swanky practices and in the very, very impoverished communities. And I see lots of reasons for the disparities, but access to healthcare is definitely one of them. So that's probably my major motivator. And in psychiatry and addiction medicine, which is my subspecialty, there's just even more inequality of access and coverage. So I've been a member of the Physicians for National Health program for quite a while, and I'm very excited to be part of the newly formed Connecticut chapter. So that's why I'm here today.
Hello, I'm Holly Hackett. I am a non-physician member of Physicians for National Health Program. I am a member of Medicare for All Connecticut and many other local advocacy groups around the New Haven area. I have been sick for the majority of my life. I have had many, many health struggles, and with those health struggles come major insurance struggles. So I have had to navigate my entire life through the ups and downs, mostly downs, with insurance companies. I have lost lawsuits. I have had to have my paychecks attached because of billing issues that were incorrect, but they do not take away those attachments once you find and fight for yourself. But that's neither here nor there. But our insurance system is completely broken, and we need a health care system to care about us and for us, and not something that is bought and sold on a stock market for stockholders. Healthcare is a human right, and like I said, it does not belong being bought and sold and traded on the stock market. And that is what I'm fighting for.
Thank you all. Two organizations were mentioned in your intros, and I think I'll ask first, maybe Marilyn can talk more about Physicians for a National Healthcare Program, because it is a very well-established organization that's been fighting for this for a long time. So can you talk a little bit about PNHP?
Yes, it was started by a couple of physicians in Massachusetts. Both of them are affiliated with teachers at Harvard Medical School. And some of their early research was around bankruptcies, that a huge proportion of bankruptcies in this country are the result of medical bills. And I think that was one of their major motivators and one of their major organizing principles, was that this is not right. And it's now a large national organization with many state chapters, and has a particular program that it advocates. So a lot of people in this movement talk about Medicare for all. I'm trying to avoid that phrase because PNHP has a somewhat different vision from Medicare. And we can get into that later if you'd like. But the idea is very broad coverage, including nursing home care, pharmaceuticals, in-home care, and it even includes retraining for people who work in the insurance industry, because the insurance industry is really the problem. It's the problem because of administrative overhead and because of the profit motive. But it also employs a lot of people, especially in Connecticut. So we can't ignore all those jobs. There's plenty of need for them in the healthcare industry, but not in insurance. So PNHP even has, as part of its advocacy, a plan for retraining and job placement for those folks.
Well, I actually think it's interesting that you make that differentiation with Medicare for, the term Medicare for all. And I think that term has been picked up because the national legislation trying to establish single payer healthcare has been called the Medicare for All Act. And maybe because the Canadian system is referred to as Medicare. But I agree that it has caused a lot of misunderstanding as we go around. We see see that misunderstanding that people want single payer, but they don't want Medicare. And, the name Medicare turns them off. But that said, the second organization that I wanted to talk a little bit about is Medicare for All Connecticut, which I assume took its name from the federal legislation. And I don't know, Holly, do you want to talk a little bit about Medicare for All Connecticut? You've been part of that group for a while.
Sure, Ronna. So what we at Medicare for All Connecticut are trying to do is to get single payer, universal, comprehensive health care to every level. So we are advocating for local resolutions in different cities and towns across Connecticut. We are advocating for a state single payer bill for Husky for All. And we are also obviously still pushing forward with the Medicare for All Act. I believe it's HR 1976. So we are absolutely sending our advocacy in every direction possible. So it doesn't matter. We want single payer, comprehensive health care for everyone. We are not leaving out anyone. Everyone means everyone. So yeah, we're tackling it from every single aspect, local, state, and federal, because one of them has to stick. It is needed. It is necessary. With the health disparities going on, it needs to change. Everyone needs to be able to have equal access to the right healthcare, equal healthcare for everyone. Enough is enough now. It has to change.
Now, we keep hearing opponents who might be affiliated with insurance companies, but are not necessarily saying, oh, we have the best, medical system in the world, the best health system in the world in the United States, and, why mess with it? So that we might have some slides to illustrate it. What are the problems with what we have in the US right now?
Yeah. Oh, here we go. Marilyn has some slides she's going to share from PNHP.
I had myself on mute. So yeah, just a handful of slides. This one, when we say we have the best system, we actually should look at the data when we say that. And this is a very simple comparison of life expectancy in countries that have some form of national health insurance. They vary compared to our country where we do not have national health insurance. And in the countries that have it, there is as much as a 5-year difference in life expectancy at birth for women. And let's see if I can move to the next slide. I think I might need to exit that. Hang on. Apologies, I am not that expert yet. So let me see if I can share that again.
And that's partly because we're not covering everyone, of course.
And I was wondering, maybe you have a slide that covers this, but maybe not, that is partly due to fairly high maternal mortality rates, when their kids are born.
There are slides like that. I don't have it pulled up right now. Let me see if I can get to the expenditures slide. Let's see. Well, I'll just say that the life expectancy at birth for males is about the same, about a 4 to 5 year difference between the U.S. and places like Switzerland and Australia. And I think this is a fairly useful slide. It talks about how much we actually spend on healthcare, which is dramatically different. Yeah, I can do that. Can you see that?
Yes.
Okay. So, how much is spent in the UK? Not that we necessarily want a UK system, about $3,000 per person, as compared to Canada, which is more similar to what we would like to see here in the US, about $4,200, and what we're spending, $8,100 per person for outcomes that are not as good as those other countries. I mean, to me, this is just the most dramatic evidence that we have a broken system.
And I think one point to make is, where the money is coming from. We're paying a lot, but Marilyn, you had mentioned that one of the driving forces behind the creation of PNHP was the huge number of bankruptcies associated with people having serious illness or accidents and needing medical care. And I have seen slides or little memes that show, how many, people in each country have lost their homes due to COVID, and everywhere else in the world it's zero. And in the United States, it's like hundreds of thousands of people. It's, really, so it isn't just that we're spending more, but sometimes people who can afford at least are being obligated to spend a huge amount.
Yes, there's about 500,000 Americans who go into bankruptcy every year because of medical illness. And that's about half of bankruptcies to begin with. And I believe about half of those people who went bankrupt, is this statistic, had insurance. They had health insurance and they still went bankrupt. So there's often a kind of surprise that people find out only when it's too late, when when their insurance really comes to the test, that they discover it's not quite as helpful as they thought it was going to be in terms of covering their healthcare expenses. And that's a quite rude awakening, unfortunately, for a lot of people. And again, so that's 500,000 bankruptcies a year. And I think compared to zero in a country with universal coverage, I think that's just one point of data that makes it hard to say we have the best system in the world.
And that includes people with Medicare having financial issues in spite of having Medicare. Holly, do you want to tell the story about your mom?
Well, I have actually a few different instances because I'm on disability, so I too have Medicare, but I've been schooled the hard way that you keep regular Medicare, but my mom has an Advantage plan, and just recently she had to go get tested for COVID, and she received a bill for $137 for her COVID test because United Healthcare told her she was not covered or eligible to get this test. I'm like, it's supposed to be free, and it was absolutely a necessary test because we had very close exposure. So yeah, it's just ridiculous. But my mom also has had a brain tumor. She currently still has an aneurysm, and United Healthcare denied her getting MRIs done on 3-month intervals because it was unnecessary. Really? Her neurosurgeon says it's a necessary test for her to have, but yet it's unnecessary at 3 months. So her neurosurgeon changed it to 6 months, and again, denied.
It should be,
go ahead, Marilyn.
It should be mentioned that this Medicare Advantage plan is a for-profit subset of Medicare.
Absolutely, yes. I'm sorry, I did not decipher. So it was difficult because, I mean, How do you know? Because a neurosurgeon says you need this test, and they were denying her this test. That can't be legal, and it certainly is immoral and completely wrong. So now they allow it for once a year, and thankfully she's stable. There's no more tumor, thankfully, and the aneurysm hasn't grown or changed, but that's not the point. The point is you should be able to get a test that your doctor orders, period, plain and simple, not a denial from someone who sits behind a desk who's protecting the profits of the stockholders. That's unacceptable. It's just wrong.
I think part of the problem is that insurance has actually changed. Before the HMO Act, it was illegal for any physicians to work for anyone other than a physician because they had to be protected from having any kind of conflict of interest. And I remember when some of the insurance companies like Blue Cross Blue Shield demutualized. It had previously been a mutual company that, although it was insurance and not really healthcare, it wasn't for profit. The people who were the policy owners were also its shareholders, were the owners of the company. And I think about a little over 20 years ago, they demutualized. I had that insurance through my work. I got a $900 check. It's like, what is this about? But things went way downhill afterwards because I got paid off. And as a policy holder, I was no longer their shareholder, their primary fiduciary responsibility. And that became problematic. One of my stories, and I worked for Head Start for many years, and it was a 10-month job, and we got health insurance through work, September through June. And then in summer, we weren't covered for July and August, but we had the option of paying for COBRA, which ate up my entire unemployment check. So you're like, what do you do? And COBRA has this, it isn't exactly a loophole, but you have a 60-day window in which to apply for COBRA. And so I wasn't insured for 62 days. So I would just leave the form like on my, bulletin board so that I could apply retroactively if need be. And in 2003, Bob, my husband, had a bicycle accident. He was in the hospital for 11 days, about half of it in intensive care. He had an internal bleeding. He had ripped his diaphragm. And it happened on August 29th. I kid you not. And so as soon as it happened, I filled out the forms, paid the check for the COBRA, the $2,500. And once they cashed the check, I knew they'd have to cover us eventually. But it wasn't straightened out till February or March of the following year. And had it happened the following day, we would have had a $45,000 hospital bill, which, because it was over 15 years ago, is a much lower bill than people would see with the same care now. And it just seems insane to have to game the system that way. And I also want to add, our hospital bill was like $43,000 or $45,000. But when our insurance ended up paying the hospital and settling with them, they only paid about half that amount. But so it just opened our eyes to what a crazy system we have. And I'm so unhappy that state employees are now, state retirees are covered by the United Healthcare Advantage program. Because after a recent accident, I guess Bob's sort of accident prone, he was hospitalized, had to have a hip replacement. And, 2 months later, he got a letter from United Healthcare saying, we might not be your primary insurance. Well, of course they are. But, they wanted to know, did this happen at in a retail establishment or in a business because they wanted to sue wherever he fell. It happened, the option that was true, which was public property, was not asked, which was great because we didn't want our insurance company to go after our city. But it was kind of crazy that they wanted to get out of paying for something that was like something that we pay for insurance to cover.
And you're really pointing out too the risks of unemployment and the way that entrepreneurship is discouraged by the fact that people can't be covered if they leave their job. Now, admittedly, the ACA has made up for that in part, and it is going to be better funded for the next 2 years. But there's no guarantee after that that we won't be back in the same soup with an ACA with extremely high copays, extremely high deductibles, extremely high premiums for those who don't qualify for extra coverage from the government. So it's just a patchwork, and it leaves so many people at risk, and it really hurts our business community because of all the expenditures they have for healthcare for employees and all the limitations on employees because they can't leave their jobs. It's just a mess.
And
Ronna, yeah, you mentioned about how things went downhill after these companies were demutualized. And I think that gets to the heart of a lot of what the problem is the incentive structure in a for-profit health insurance industry is to make profit. And if you're a health insurance company and you want to make profit, you need to pay less in claims and collect more in premiums. And we had like Mutual Insurance of Omaha. We had these not-for-profit health insurance models. And at some point, the lobbyists won out, and people realizing there was gold in them our hills if we could find a way to turn this into a profit-making industry. And all we need to do is convince the politicians to make it legal. And that's what they got. And then, right? And then we get a for-profit health insurance industry that's leaving people out and saying things like, oh, if you have a pre-existing condition, I'm sorry, we're just not interested in selling a policy to you because we know you're going to be expensive for us to cover. And it's just inhumane. But that's the kind of thing you started to see when you have the profit motive introduced into health insurance. And the ACA, although it did enact some protections like preventing requiring that health insurance be sold to people with pre-existing conditions, it's still just a system that kind of ties together all the private insurance markets into the exchanges. There's still private insurance. There's still for-profit insurance that you're being sold on these exchanges. So it doesn't get to the root problem of the profit motive. And single payer Medicare for all, whatever we want to call it, and I understand it is confusing. And just to clarify that, when I say Medicare for all, I mean comprehensive, universal coverage that you don't have to pay any premiums, you don't have to pay any copays. It covers health from top to bottom. It covers vision, dental, hearing, long-term care, nursing care, and you don't have to buy supplemental insurance like the Medicare Advantage plan. That some people think, when they hear Medicare for all, if they have Medicare, they say, well, Medicare for all isn't that great. I still have to buy this supplemental insurance. Well, with Medicare for all, we really mean improved Medicare for all, comprehensive Medicare for all that doesn't require any supplemental insurance and that requires explanation because there is a problem. It's getting the terminology right. But what we do with single payer national health care is we become like shareholders in a mutual insurance company that is our country. It's like America becomes we enter into a mutual insurance agreement with all of each other, where we say we're all going to pay in to this pool, and whenever any of us are sick, it will be covered. It's really just creating a single mutual insurance structure. It's not a company. But it's similar to that idea that we're all shareholders. We all have an interest in being insured for our health. So let's all pool our resources, and we can do that in a fair way, in a progressive way, in a progressive tax structure, so that those who can afford to pay more will pay some more. But we all get the same care, including Congress people. So they will have a motivation to make that health care comprehensive, because it's the same program that they themselves are getting covered under. And I think that's a big advantage as well, And it's a system where we all have a vote. It's a system where we have some control, we have some say. People, I've heard, when I make the argument for Medicare for all, you hear some people say, well, you can't trust those hoodlums in Congress. And well, what makes you trust the hoodlums in the insurance companies? At least with the hoodlums in Congress, I can vote them out of office if I really want to. At least you have some control, as opposed to none. At least you have a fighting chance. And so that's why I think we're better off putting our faith in each other and in our democracy and our mutual, in mutually insuring ourselves, rather than leaving it up to people with conflict of interest, with a financial conflict of interest that really isn't in the best interest of our health.
Yeah, as that last slide showed, this plan would cover Congress people too, so they would be motivated to make it reasonable.
And Justin, you mentioned before, you used the term pre-existing conditions, which we are all very familiar with, and I appreciate that is one thing that the ACA did provide some help on, but it's just an odd circumstance that Americans all know what pre-existing conditions means, but in the rest of the world, they don't even really have that concept. It's your health history. You go to a doctor, you need medical care, you provide a health history. The term pre-existing conditions is just a way for the insurance companies to not take responsibility for your health care based on what you've been through in the past. And you get to a certain age and everyone's got something pre-existing. And I heard a lot of concerns that now and into the future, if we lose protections on this on pre-existing conditions, okay, so is COVID going to be a pre-existing condition now? And anyone who tested positive be denied services or denied health insurance? It's just one funny little detail that we've gotten used to, but is just a product of our profit-driven system.
Can I just jump in for 1 second? And when you were all talking about Congress having the very same plan, I was very excited by that prospect, because a lot of us, even though there's the ACA and everything like that, those of us with pre-existing conditions are petrified about any other changes unless it does truly go to a single payer universal comprehensive system. And other than pre-existing conditions, those who are low income, especially in like the Black and brown communities, a lot of people don't understand that you can go to your doctor for a preventative care visit and it's supposed to be free and covered, even if you have a $6,000 deductible. People don't realize that is not supposed to be. They still get charged by their doctor's offices. They still get billed by their insurance or say, oh, that's not covered because it's part of your deductible. And I've said that's not true. That's part of the ACA law, where that's part of your preventative care, for female care. No, you're not supposed to be charged. That's covered. No, but yet the insurance companies don't follow those rules, and they will say, nope, sorry, you're not covered. That's part of your $6,000 deductible. I'm like, no, you need to fight for that. That is covered. That is part of your preventative care through the ACA. And a lot of people don't know the rules and the regulations because, as Marilyn had said before, we are in a 100% patchwork, broken system. And not everyone knows how to navigate our current healthcare nightmare. Well, it's not a healthcare nightmare, it's an insurance nightmare. And as the great Representative Ann Hughes says, she says we need to turn Connecticut from the insurance capital of the world into the healthcare capital of the world, because we do have everything in place here in our state of Connecticut with the hospitals and the universities that turn out all of these amazing doctors and nurses and healthcare professionals. So we have all of the skills, the skilled people, and the facilities right here in our state to do this. We just need to change the insurance industry back to getting out of our healthcare decisions so that we can be healthier, period.
When you were talking about, having to fight to get coverage that, people are legally entitled to, it occurs to me that we should be charging the insurance companies like at least a $15 minimum wage for like all the hours people have to spend on the phone and gathering documentation. The doc for medical practices, I can't imagine what kind of a nightmare it is. I had a dental implant done a couple years ago, and like the oral surgeon office, it's 2 oral surgeons, and they do a few other things, but they have a full-time billing person hired. So even fairly small medical offices need to have at least one full-time employee to deal with billing and insurance companies. And I think I had seen at one point a diagram that like Johns Hopkins Hospital had like 1 billing agent per bed. It was like some insane number of people to, work on the finances part. And it just complicates things. And of course, drives, big profits for insurance companies, because this past year in particular, they have made a lot of money.
I wanted to make the point that, this issue of preventative care is really important in terms of having access to preventative care. Not only does it ensure better health for the patient, but it ensures lower costs of healthcare for that patient over the course of their lifetime, because they'll be healthier, they'll need less care later. It's just the old wisdom that a stitch in time saves 9. You spend a little bit now to keep a person healthy, and you're going to have to spend a lot less later to correct whatever disease has been left to go untreated and has festered. And that's one of the reasons that this requirement of making preventative care free in the Affordable Care Act made a lot of sense and was a smart thing to do. And it's unfortunate that it's really not always working out, that people are still getting billed and still getting discouraged from getting primary care. And I think I've seen it estimated that there's $200 billion in costs associated with disease healthcare costs that we could avoid if we had universal preventative care. for everybody. And that's just one of the ways in which universal single-payer healthcare would save us money. And the estimates are up to $600 billion a year. People say, oh, this is pie in the sky, this is rainbows and unicorns. Well, no. This is not something where you have to ask, how can we afford this? This is a cost-saving reform. A tremendously enormous amount of money would be saved by switching from the healthcare patchwork system we have now, where only 85% of people are covered, to covering everyone. We'd save so much in efficiency and reducing fraud, and being able to negotiate drug prices are three of the major cost-saving areas, not even counting that we would save money by having better universal preventative care. That's another 200 billion on top of that. So, there's about 300 million plus people in the country. So saving up to $600 billion, that's about $2,000 per person in savings every year. That's about roughly, back of the envelope calculation, that's up to $2,000 less in healthcare expenditures for every man, woman, and child in the country on average. And that's, a tremendous amount of savings. And we're switching to a system where everyone gets taken care of comprehensively. So I think there's really, there's no fiscal argument against Medicare for all, as far as I'm concerned.
And, the City of New London, many viewers will know, passed a resolution in support of, any of this kind of legislation, either at the state or the federal level. And it passed unanimously. And one of the reasons was how much municipalities are spending on this. I think even if one of our fairly conservative city councilors couldn't vote against it when he saw the numbers. I think New London, out of a $90 million budget, spends 15 to 20 million providing health insurance to current employees and retirees. It's and those costs could be reduced we used the formula in the Bernie Sanders previous bill to give an estimate of what it would cost municipalities as employers. And it was something like a 70% savings. So this line item that is $18 million might be able to go down to $5 million. Imagine what cities that are cash strapped could do with that extra money. So before we start talking about the various bills that are up this year, acknowledging that for some people, change is scary. And, people who have not traveled abroad or have not lived abroad often feel very nervous because at least what we have now is something we're familiar with. Can you give an idea of what it would look like to live under a single payer system?
Well, before we do that, I would just like to knock down a couple of myths. Like
Sure.
one of the myths is without the insurance companies making these profits, and particularly pharmaceutical companies making profits, we wouldn't develop new drugs or new treatments. And in fact, we already pay for those. Most of those new drugs and treatments come either from the National Institutes of Health, which we pay for, or for universities, which we mostly pay for. So there's people get frightened by a lot of myths that just we don't really, they're not accurate, they're myths. As far as what it would be like in a different system, I haven't had the privilege to explore much of that. I'd be interested in what people, if there's like from the ground stories of what it's like to be in a different country and have health care.
Well, my two kids were born in Israel. We lived there for the first half of the 1970s. And I would not say that the healthcare in Israel in the early 1970s was at all luxurious. It wasn't, but I never got a bill, and I got the medical care I needed. The only potential problem we had is that, Bob and I have an Rh incompatibility. I did not know I was Rh negative before I was pregnant. He actually thought he was Rh negative because his mom is, but he isn't. But, back then they had ROGAM, about when the US did. So everything else was just taken care of. And as I said, it wasn't fancy, but it was the care that was needed was provided, and no cost at point of service. So people did not even have to think about the cost of what kind of care they needed before going and getting it. But I have noticed that many of us who are active in Medicare for All Connecticut have spent time living abroad and experienced it. And the other thing I want to point out, and we've mentioned, the COVID shots and testing, is that would be a little bit more like what a system would look like, how the COVID response has been. You're exposed, you go to your doctor or to a clinic and you get the test you need, or you get the treatment you need if it's positive. And with the exception of Holly's mom, most of us don't see a bill. And you are muted, Holly.
Yeah, that would be great. I mean, everyone is going to get their tests done. Everyone's going to get their shots done. No one has to get pre-approval. No one has to wait for any kind of insurance billing problems or issues. I haven't gotten a bill. Well, I have regular Medicare, but so yeah, I think it would be terrific. I could go anywhere, get whatever tests I need done, and not have any issues. That's terrific. I'm jealous for those who have lived abroad and could walk in anywhere and do whatever they needed and not have to worry about ever getting a bill. That would be amazing, I think. I can't wait for it to happen here, and I'm pretty sure it's going to. I have faith.
It will. I just don't know if the state level will be quicker or the federal level, but there is good news from the neighbor, our neighbor, New York, that they have enough co-sponsors in their universal healthcare bill this year to pass it. And I doubt that the governor would veto it in the current, climate. Even so, he's kind of been trying to, with all his problems, sort of make himself out as a healthcare hero during the COVID year. So, we might see that implemented next door to us. And I think Marilyn had mentioned the entrepreneurs or just who are insecure and at financial risk because of lack of insurance. If I were an entrepreneur and I knew I'd get affordable health care, by crossing the border into New York State, I'd consider it. I think Connecticut could be quite at risk of population loss if the surrounding states create much better healthcare systems, and we just continue being mostly loyal to our health insurance industry. So maybe we can talk a little bit about the bills. I have not really looked so much at the federal House Bill 1976. I'm thinking it's similar to the last federal Medicare for All single payer bill. Has anyone in this group had a chance to take a look at that?
I've taken something of a look at it. I haven't read it word for word, but it is similar to the previous proposal. I am running for Congress, and I do have some of my own ideas about how I think things should be funded. Generally, just speaking for myself, I think that progressive taxation is what makes a lot of sense when we have a large expense that needs to be paid for on a federal level, really any level. I believe that there is, the old saying of the rich get richer and the poor get poorer is just a universal truth. People with advantage are going to continue to parlay that advantage into more wealth, and people in poverty are going to have trouble getting out of it. And I think it's the government's place to take the edge off of that tendency, so to speak, with progressive taxation. And that's why most places have progressive taxation. That's why it works. The rich can afford to pay a little bit more, and it just kind of puts the brakes a little bit on what would otherwise just be a natural accumulation. We've kind of seen that with the cutting of tax rates for the very wealthy. We've seen them kind of take off and skyrocket in wealth, and that's not a surprise. That's why we have progressive taxation. So if I had my say for how single payer would be paid for, I would be happy to see it paid for with a federal progressive income tax exclusively. I have to see how many other members of Congress I could convince to go along with that, but that would absolve employers across the board of having to incur any expense, and that would also, in a lot of ways, be such a cost savings for private employers and public employers, municipalities, states. I really see no reason why we couldn't let them off the hook. Everyone who has an income pays a tax. We have a progressive income tax system in place. We need some improvements to it. People who have passive income are paying lower rates than people with active income. If you have passive income from investments, you're paying capital gains taxes at lower rates than many people are paying on income they earned by working hard, and that's not fair. We need to fix that. But in the end, I really think we could have a win-win here, where we really we do something to address economic inequality with more progressive tax system. We take some of the financial burden off of businesses and municipalities and states who are struggling to make ends meet, and we provide healthcare for everybody. So that's fiscally what makes sense to me in terms of that's kind of my vision for a big picture, how I would like to see things move.
Now, we all agree that a national program is really ultimately what's needed, but seeing that in Canada, that their national program started in one province, there has been action in many states in the United States, and there are a couple bills in the legislature right now, and I wonder if you'd like to share some info about what's happening in Connecticut and how people can support it.
Did you want me to answer that, Ronna?
Sure. Yeah.
Okay. We have currently SB 1090, which is an act establishing a commission to study a Husky for All single-payer universal health care program. It passed the Human Services Committee, and now we just have to see if it will get onto the floor. So we need legislators to sign on as co-sponsors. And also, we need leadership to bring it to the floor for a vote. So we need to once and for all get the question answered. Is it fiscally responsible and sound for Connecticut? Which we all already know that the answer is yes. It should be a no-brainer for conservative people. It is a no-brainer for those of us who know it's the moral thing to do. Also, we have HB 5340, which is an act concerning establishing a single-payer healthcare system in Connecticut, which we were very very much a part of writing bill language for. We brought in all stakeholder groups, mental health, substance use disorder. We brought in a lot of other groups to help us with the proper language to use. It's a terrific bill. Unfortunately, it got stalled and killed in insurance and real estate, but that doesn't mean we can't have more co-sponsors sign on to that one as well, because it really is very, very well written. And it is extremely comprehensive, including covering community health workers and doulas and alternate care like chiropractic and naturopaths, by licensed people, not, other people who are not licensed, but those who are licensed by the state of Connecticut. We want care to be covered as well. So, we are really, really trying for everything to move forward so that Connecticut doesn't fall behind, since New York is very close to passing theirs. I believe Rhode Island has one in place, and Massachusetts as well. So we will really be at risk for losing some of our best tradespeople if we don't get on the ball and do the right thing.
And, when you mentioned the access to care in Connecticut and all the bills, I was reminded that, it's been a big controversy this year, the getting rid of the religious immunization exemption. And I personally, and this isn't really the topic of the show, but I don't think religion is, rather than science, should guide our medical decisions. However, I think many people use the religious exemption in cases where there might be a valid medical exemption, but they don't have access to medical care. And, low-income parents who have kids who have immunodeficiencies or other kinds of illness or allergies, and if they all had medical professionals they could work with to figure out what a sensible immunization schedule is, I don't think people would care about taking this religious exemption. But if you don't have a doctor, it's a problem. So there seem to be just so many economic and social problems beyond just healthcare and health outcomes to the lack of access to healthcare that people have. I guess the last thing before we sign off is I wanted to let people know how to get involved in different organizations and learn more and advocate for this. So Marilyn, I think you first maybe can talk about PNHP.
Yes, Physicians for a National Health Program is pnhp.org, and anyone can become a member, even if you're not a healthcare professional, for a fairly low $50 per year membership. And even without the membership, it is a great resource to learn more about all these issues. Lots of material. We do have a PNHP CT, the Connecticut chapter, but we do not yet have a fully functional website, but we soon will, pnhpct.org. And so you might check back for that. And at that point, when you see our website, you could sign up on the website and even be invited to our meetings, which would be great. More voices.
And I don't know, Holly or Justin, do you want to talk about Medicare for All Connecticut, which also does not have a fully functional website, which is my job, but does have keep its Facebook page very updated. But talk about, what kind of involvement people can do with that.
Okay, Justin, I saw you pointed at me to say for me to go. Okay, so for Medicare for All Connecticut, please check us out on Facebook. We also have Twitter. I believe it's Medicare, the number 4 all CT. I'm not really good with those parts, and I can't connect it on the chat like probably Justin is ready to
We'll
do
try
right
to add
now.
those labels or a slide
Oh,
at the end
thank you.
of the show that
Thank you,
has all the
Ronna.
different websites on it.
Thank you. I appreciate it. We are getting involved in doing and helping with the Hampden resolution, the New Haven resolution, and contact us at info@medicareforallct.org. And if you want to get involved with any kind of local resolutions, if you want to start a resolution in your town or city, if you just want to be a part of the statewide advocacy or even the federal advocacy, we're always open for help and joining our ranks. We'd love to have you a part of our group. So please come join us. And our meetings are on the second Tuesday of every month.
And a lot of the meeting, much of it is taken up by having presentations from really people who are working on this throughout the country. So it's pretty inspirational. And Justin, you might want to tell people what your campaign website is if they want to just learn more about it.
Sure. I want to encourage people to get involved with Medicare for All Connecticut and Physicians for National Healthcare Program Connecticut, both great organizations doing great advocacy. And I also want to encourage people to contact their legislators and get involved in politics and be careful who you vote for. If you really believe in this issue, you really want to support this issue, make sure you know where your candidate stands before you give them your vote. And currently we have Johanna Hayes is the only 1 out of 5 representatives in the state that is supporting single payer national health care. That's only 1 out of 5. The others, including my opponent, Rosa DeLauro, do not support single payer. And among our senators, only Richard Blumenthal supports single payer. Chris Murphy does not. So I came to the Green Party, and I encourage other people to come to the Green Party because it's nice. It's, to say the least, it's really nice to be in a party that's fighting for the things you believe in from the top down. Someone mentioned earlier about how for a bill to get voted on, it needs to be brought to the floor. Well, HR 1976 is not the first iteration of Medicare for All legislation. We had it in the previous Congress, and it just sat there for 2 years. It had 118 co-sponsors, but it never got voted on. It sat there. Why? Because the leadership of the Democratic Party does not support it. And so Nancy Pelosi did not bring it to a vote. It's just that simple. So, if you want to be part of a political party that supports single payer healthcare from top to bottom, I welcome anybody who's interested to join the Green Party of Connecticut. And Ronna is a very active member, and I'm a new member and a candidate. And if you're interested in my candidacy, I am at justinforall.org, and you can find me there, and you can find my email and my Facebook and my Twitter. And we are looking for people to join the campaign as volunteers as well. We'd be happy to have your support.
Thank you. Any last words before we sign off for the day?
I want to say thank you, Ronna, for having us on.
Well, it's fun. I'm looking forward to the day when some of us can really just sit around a table and see each other in person. But this is good for now. And thanks for coming on and talking about this subject. I think over this past year, this has become the number one issue in this country because it touches so many people, so many businesses, so many families, so many towns and school systems throughout, just from top to bottom. So hopefully we can get something done. So good night, everyone. We'll put this show up on YouTube, and it will be airing next Tuesday on Atlantic Broadband at 7 p.m., Channel 25. If you live in Eastern Connecticut and you have their cable TVs, you can watch it, but we'll have it up on YouTube as well. So thank you so much for joining me. And to all of you out there, we'll be back with something else in a couple weeks.